And I also need to make sure we go to Facebook while I'm looking at this. So, Dr. Esther, do you mind welcoming us to the call and start an introduction while I fix this up?
Well, welcome everybody to Sister Doc Spilling the Tea every Wednesday, except the one Wednesday every month, which we'll let you know. My name is Dr. Esther Ngare. I'm a family physician based in Houston. I got onto this journey with Dr. Tiffany. Actually, the first person I spoke to who convinced me about this was Dr. Tiffany. So it's kind of full circle that a year later we are doing this together. I have found a way to include this protocol that we're going to be talking about in my first in my life. And then because of that, it's peeled into everybody around me. Because when you have this measurable and results that people can actually see, then people ask you what you're doing. And I figured, might as well start sharing with the person next to you. And then before I knew it, I was sharing it all over the place, and across the world. So that is me. And my sister doc here is Dr. Tiffany Marie. I will let her introduce herself. She's been really an anchor for me with all this, the science, the education, the business. So, and that really is what this is all about. It's teamwork.
Yes, yes, yes. Oh, I appreciate that. I remember when I had to pull away from a meeting and talk to this lovely doctor who was just so excited to hear what we do. It's so nice to connect with people who get the vision. So, hello everyone. I am Dr. Tiffany Marie. At least that's what I go by on social media. And I am a double board certified physician in family and lifestyle medicine. And I actually did whole 20 years doing urgent care, telemedicine, private practice. And those last few years of telemedicine, I realized across 48 states, oh, we are struggling. And then, as we know, as we branch out to different countries, oh, so many other countries are struggling too because they've adopted some of this American processed food lifestyle, right? And I want to do more. And so I got board certified in lifestyle medicine to go after the root causes of conditions. But at the same time, I got connected with a mutual friend of ours who I get to travel the country with, and even outside the country too, but an engineer no less, that told me about these products, and I started using them, and I've been having great results. And now I want to keep talking about them to other people who understand, to spread the mission, spread the vision that we have. So I'm excited that I get to do this with my sister doc. And yes, that's who she is. I am excited I get to do that with her every Wednesday. So welcome, welcome, welcome everybody for joining. Um, Now we have somebody who has a great story, a great story. And I'm gonna let her tell her story while some people are still joining. Um, but I actually live with her in Huntsville, so we get to work together and see each other like in person a lot, which is helpful because there's something about that connection and the energy that you share. But she's somebody who you would think, oh, she's healthy. Why would she even need these products or care about what we're talking about? And I think it's so important for us to show just because you think you're healthy doesn't mean you actually are. And there's so many things we can do to still improve our health. So let me get us out the way so I can let in Miss Jenny Mayers. Okay, babe.
Hi.
Hi, Jenny. Well, I'm happy you're on here. And yes, of course, we talk all the time. But
Thank you.
if I can get you to share where you were before you started even looking at these products, what you noticed, your big wins, and let's start from there.
Well, it's important that I tell this that God has given me a passion to be able to want to help people, no matter if I was healthy or not. I've been on a health journey forever, and I've always had a desire to help other people. So then I'll say, as I was healthy and on a plant-based diet, which I thought was the right thing to do, I developed type 2 diabetes, rheumatoid arthritis, colitis for 10 and a half years. Painful, just aches and pains all over my body, especially my wrists and my hands and my ankles and my feet. My arthritis really showed in that, and in my back. I had inflammation in my gums. I was diagnosed with osteopenia after taking a round of prednisone once upon a time for my colitis. So porous bones, which supposedly can break easily, but thank God they're not breaking at all. Tore a retina in my eye. So just a host of whole bunch of things. Was told that I was pre-diabetic by a doctor about 7 years ago. And he told me to make sure that I ate every 2 hours because I had low blood sugar. So I don't know how he determined that, but I did. I started eating every 2 hours, and it was plants. So I have always been my ideal weight for my height. I'm 5 feet, I weigh 105 pounds, which is, perfect for 5 feet. And I was told to eat every 2 hours. So I would eat like 5 organic olives, 2 organic walnuts, an organic celery stick. Everything was organic, and I was eating it every 2 hours. So when people tell me every day, I'm not eating the wrong food, I'm healthy, eating so frequently is how I got type 2 diabetes. So, and right after I was diagnosed with type 2 diabetes, I was told that I also had cataracts formations in both eyes. Driving down the street one day, this is how I found out I had diabetes. Driving down the street one day, my left eye went black. I couldn't see anything out of it. Went to the optometrist. He sent me to the eye surgeon. Eye surgeon looked in my eye and said, not only do you have a torn retina, but you have diabetes. And you have cataracts in both eyes at the age of 55. So
Wow.
my mind was blown, because here I am, a health coach. I had a program. It was $2,000 for people to go through my program. And I had like 20 something people go through my program, and I helped them get healthy. And here I was, not healthy, right? Thinking I was eating 85% raw food, 15% cooked food. It was all vegan. And I thought that was the way to go. So no matter how healthy you think you are, I always say stress can kill you. So I had a really stressful situation going on at home. But anyway, was serving food at a restaurant, and a lady walked in one night, and I couldn't eat gluten, I couldn't eat dairy, I couldn't eat sugar, I couldn't eat. I was such a limited. Oh, the colitis was of all the things. If I was to pick one, colitis was the worst. And so what was serving at a restaurant, served this lady, and I said, I have all these digestive issues. And the lady who owned the restaurant said, I'm going to give you a dessert right now. I said, it's 9:30. If I eat sugar, dairy, gluten, all that, I'm going to be violently ill for the next, who knows, 2 to 4 hours. And my nose is going to run. I'm going to have diarrhea. I'm going to have bloating. I'm going to have gas. And I'm working. I can't do that, She said, no, I'm going to give you this product. And she held up a product that she called fiber. And she said, I want you to mix this up in water and drink it right now. And then I want you to eat the dessert. And I was like, oh gosh, I don't want to do that. It's scary. I had a lot of food fear, so I was just afraid of things, because if I would eat black beans, I could be in the hospital for 3 days with rectal bleeding and vomiting and diarrhea and get so dehydrated. So black beans, lentils, and chickpeas were probably my biggest offenders, but the combination of a whole bunch of things also made me really sick. Anyway, took the fiber. I was fine. Sat there talking to her, and this is our friend Emery. For 2 hours we talked, and she said, you haven't run to the bathroom once, so your stomach isn't sick. You don't have a runny nose. All the things you said you're going to get. How come none of them's happening? And I was like, oh my gosh, I don't know. What is this magic in this bag? This little sachet. She said, yeah, I told you it was going to work. And I said, I literally have tried everything. I don't try over-the-counter medication, but they actually put me on Humira, which is injections that turns off your immune system, which, if you don't know anything, innately you know to not turn off your immune system when you're sick, right? I had an autoimmune disease, and turned off my immune system with these injections. Well, the injections almost killed me. So that, so there was a lot of close calls. Almost died 3 times from over-the-counter medication or intense medication because of side effects. So I was not a fan of trying anything. Anyway, that night I went home, and I said, I don't want to go home without this. I need more of it to go home with, because I don't want to wake up without it. Woke up the next morning, signed up to be a partner the next morning, because every time I learn about something, I have to share it with the whole world. So started sharing it with the whole world, and probably shared just at home about 17 people today. So it changed my life. My life is so different. Being able to go out and eat in public is huge. I would have to stay close to a bathroom, like not more than 2 feet away from a bathroom, because I said, although I was 55 years old, I felt like I was 80, because 10 and a half years of rectal bleeding and gas and bloating and explosive diarrhea and everything you can imagine, all the horrible stuff that you feel like you're just old and you're aging fast, and almost losing my life because of all those things was really intense. So now I pretty much live pain-free, I still have supposedly rheumatoid arthritis because, you know, they don't ever say you get rid of it, but I don't have any pain from it. My gums don't bleed when I get my teeth cleaned. All the things I used to suffer from are gone, and I feel amazing. And I'll be 58 this year, and I feel incredible, you know. So this is, I say I may be aging, but I feel younger every day. So
Yes, and this is coming from a lady who rock climbs, and every 5 seconds she's doing something active. So much so you got to make her sit down. Where, you
exactly,
know, you
extreme.
used to pass, I know, used to pass by restaurants and be like, I can't sit, I can't go to that restaurant because that
Yeah,
chair is a hard chair. I
yeah,
can't sit there. And
yeah.
so getting your life back means everything. I'm sure
It
it does for
does.
you.
Yeah. Yeah. Couldn't sit in
Yes.
metal chairs or wooden chairs because I have scoliosis. Forgot to say that. And I would feel like I was 80 years old if I sat in a metal or a wooden chair for more than 10 minutes. I would get up and hardly be able to get out of the chair. So now I could sit for hours in any kind of chair and don't even think twice about it. So
Yes. Yes. I love that. And the pre-diabetes, because they had the nerve to tell you you had pre-diabetes. You thought you were doing everything right.
that's
So
right.
that's the whole point. You know, you can feel like you're doing everything right and still just not be there. And it's not because you're doing everything wrong. It's because we need to look at some more things. So that's
Well,
what we're going to
and a
talk about.
doctor is the one who told me to eat every 2 hours. So I always
Yeah.
say, you know, thank you, doctor. So when people say I have to go talk to my doctor first, I say you might want to think twice about that sometimes because you know they don't really necessarily know about nutrition. You know, there's a lot of people that are doctors that don't study nutrition and they don't really know what to tell you when it comes to nutrition. So, you know, I literally got type 2 diabetes from being pre-diabetic and jumped into diabetes in less than 2 years from eating every 2 hours. So
Yeah, yeah. Well, that's the whole point is us learning more to be able to educate. So I definitely don't say you may not want to go talk to your doctors. I want you to talk to your doctors because I want them to see the change. Because if we can
that's
get
right.
more doctors to get it, because again, you're talking to two doctors on this call,
Right,
Jenny. So
that's what
that's
I'm
the wrong
saying.
comment to tell us. But
Because I love you, doctor, but you know, sometimes the advice is, you know, I mean, the truth is, you know, now, as far as I know, you don't really get a whole lot of nutrition advice, you know, from doctors. They really don't have
Mhm,
time. You don't, you know, because you were patient after patient after patient. There's not a lot of time to spend talking about food and nutrition, you know?
mhm, mhm, mhm. But yeah,
And the other thing is to know who has shaped the talk about nutrition and about food. It
yes.
doesn't always come from a science point. It comes from a consumer and profits point.
Right.
So, you know, who's benefiting when you're eating every 2 hours, you know? So you also have to see who has driven the conversation in the past and who has had the loudest voice. So we've listened to that. And
Right.
now the good thing is that there's this movement of people saying, wait, hold up.
Mhm. Yes.
Why are we doing this? If you actually examine it, is it really right for our bodies or is it right for somebody else's pocket? And so when we start looking at what is right for us, it also changes what we think. And even us as physicians, we are also beginning to change what it is that, you know, what are we looking at? And all this advice that we've probably been sharing with our patients and actually stopping to say, wait, where did this come from? Is this really the science? And once you look at the science of the way the body is designed, then you're like, wait, let's start giving different advice, you know?
So we all
Yeah.
need doctors like you guys.
And we're going to get them as we educate those we come
That's
across.
right.
But Jenny, you were awesome. Thank you so much for
Thank you.
sharing your story. Your story is very powerful. Everybody's story is important. And so let me get into why we're even on this call. What's the science? Why are people having the issues that we're having? So let me share my screen so you guys can see it. Because like Jenny, and so many people, we're not just talking about sugar. We're not just talking about diabetes. We're talking about insulin resistance. And so when I do say insulin resistance, what do you all think? That's what I always like to talk about is what do we actually see? What do we think of? And a lot of times I've come to realize that you say insulin resistance, and most people are thinking about diabetes, blood sugar, pre-diabetes, but they're never realizing that there's so many other underlying conditions that start way before the sugar goes up. Okay. And so when we associate insulin resistance with sugar intake, we miss all the other stuff and the fact that it's behind the root of so many other severe metabolic conditions that I'm going to talk about. So let's understand what insulin is. So insulin is a crucial fuel switching hormone that plays a key role in regulating energy levels. Okay, your fat storage, your hunger, your hormonal balance, your metabolism. Okay, so when we actually have a balanced insulin level, then we can switch between fuel usage better, okay, and supports our performance and overall well-being. And so how does this happen? Well, refined carbs. They keep the insulin high. And when I say refined carbohydrates, I'm talking about those processed, ultra-processed carbohydrates, those things like those snack cakes, those cookies, the white sugar. So that frequent consumption of those refined carbohydrates, even your white bread, that's going to trigger consistent insulin release. And then that constant eating pattern keeps the insulin levels elevated. And over time, like my teenagers would do, if I keep screaming the same stuff, they stop listening. And so do our cells stop listening to the insulin resistance. And now we have two problems. We have elevated insulin, and we have cells that aren't responding to that hormone well. Okay? And so when these cells don't respond, that means that one, the body has to produce even more insulin because these cells aren't responding. So now you have more insulin in the bloodstream, okay? Leading to a cycle where more insulin is required to manage glucose levels effectively. That's why your type 2 diabetics who are put on insulin shots, over time, they need more and more insulin because they are actually worsening insulin resistance with that outside insulin. And then when you have high insulin, that high insulin makes those fat cells grow. It fills those fat cells with glucose. And now you're having that fat around the midsection, around the organs. That's the fat that actually takes us out of here. And then, of course, that decreases energy, and you have a hard time losing that fat around the midsection. Now, because with insulin resistance, its ugly twin sister is inflammation, that starts messing with the gut, starts messing with the wall of the gut. And now you get problems even with gut dysbiosis. So we have bacteria in our gut from our mouth to our anus. Okay, that's the gut microbiome. And there's good bacteria there and there's bad bacteria there. A balance is what keeps our gut healthy. But eating those ultra processed foods, eating fruits, well, not fruits, but fruit juices. I'm thinking like the processed juices is what I'm talking about. Not getting enough fiber, the toxins in the food we eat, if we don't manage our stress and sleep well, all those things start to mess with that balance. And when it does, then you get things growing there that aren't supposed to be. Your yeast, okay, you get bad bacteria overgrowing. And we need the bacteria to be working well because they break down the food we eat. So many people have deficiency issues when the reality may be that their gut is not able to break down food they eat effectively to get those nutrients out. And then the inflammation. So the inflammation weakens the lining gut. That's how you get stuff kind of leaking out into the whole body. Now you're getting toxins leaking out. You're getting bacteria leaking out. You're getting food leaking out. Stuff that's not supposed to leak out of your gut starts to leak out. And when this inflammation is high, you actually get weakening of T cells, which tell your body what not to act. And so they're confused. So you have this stuff leaking out, you have your poor immunity, your T cells confused, so it starts attacking itself, its own tissues. And that's how you end up with those autoimmune conditions, those things like Hashimoto's, where you're attacking your thyroid gland, or your brain with multiple sclerosis, or your joints like rheumatoid arthritis, like Jenny was referring to, and so many other things. And then it also affects our mood and our cognition. Our mood, because 90% of the serotonin actually comes from the gut. So if your gut is not functioning well, the bacteria are out of balance, you are making that serotonin. Okay, so that actually affects the whole depression, anxiety loops. Okay. And then your gut health also affects your mental clarity, your emotional stability. And if we actually restore gut health, it can improve your performance, your mental clarity. It can restore gut balance and leading to overall well-being and performance. And so what are the signs and symptoms of insulin resistance? Let's talk about it. Constant hunger and cravings. That whole eat every 2 hours, there's a lot of people that feel like they need to eat every 2 hours when they're dealing with insulin resistance, okay? Those cravings, you're craving for those sugars, those carbohydrates. The fatigue after meals, that's because you had a high spike of that glucose. The insulin had a subsequent spike to bring that glucose down and overshot, and then your sugar dropped. And it's that roller coaster effect that leads to that fatigue, the itis. Same thing with the brain fog. It's that roller coaster effect. The anxiety and depression We talked about that in regards to one, the roller coaster effect of the sugar affects that, but also your gut. And then the belly fat, the visceral fat, because when insulin's high, that's where it is stored, around the organs, around the belly. And when insulin is high, it's going to keep you in fat storage mode, making it hard to lose that weight. And when insulin's high, it also makes your kidneys hold on to salt, hold on to sodium. So it's not just the sodium you take in, now your kidneys are holding on to when you're dealing with insulin resistance. So it's more of the carbohydrates that led to the insulin resistance that have you with the high blood pressure, not so much the salt, which is why so many people I would see and they'd have high blood pressure. They say, oh, but I don't add salt to anything I eat. I'm not adding salt, doc. Why do I have high blood pressure? Well, it's all the carbohydrates you've been eating, the processed foods, the processed snacks. Okay. And then the abnormal triglycerides. When insulin's high, it actually makes the liver increase triglycerides and decrease HDL. That's why that marker looking at your triglycerides divided by your HDL is very helpful in understanding an insulin resistance score. And then skin tags, because insulin can behave like a growth hormone. And so when it does, now you're having tags hanging on your neck, under your arms, on your abdomen, okay? As well as dark patches because they're layers of skin, of overgrowth of skin. So that's not necessarily dirt. Sometimes that's insulin resistance. Hormonal dysfunction, as that high insulin actually deals with the ovaries, it decreases, the eggs that are actually dropped. And so it actually it's the leading cause of infertility for women and ovulatory fertility for women. That's when you cannot drop an egg, and ovulatory. That's what that means. But you can also make cysts. You can also have hair growth. Okay, there's so many women struggling. You can even have irregular menstrual cycles, so where you have some heavy menstrual cycles. And so many women struggle with this without a real answer. And the medication that is usually the first thing prescribed is metformin, a medication we use for diabetes because the science supports that insulin resistance is behind PCOS. And then poor sleep and low energy definitely affects all of this. And then the disease outcomes. Let's talk about it. Heart disease, still the number one killer. This is what's taking us out of here. And insulin resistance is at the core of this too. Stroke as well. Okay, elevated insulin levels lead to the arterial plaque buildup, raising blood pressure, and damaging those blood vessels. It actually impairs nitric oxide when insulin is high, so it doesn't allow those blood vessels to dilate. So now you have stiff blood vessels. And when I was mentioning how it makes you hold on to sodium, now you have increased blood volume because water follows sodium. Okay? And then development of fatty liver disease, because it actually makes the liver make more fat, which we talked about, and dementia and cognitive decline. Now, Alzheimer's disease is actually called type 3 diabetes now, because that is really insulin resistance of the brain. And chronic inflammation and insulin resistance can impair brain function, leading to memory loss and cognitive impairment. And we talked about the autoimmune diseases like rheumatoid arthritis, lupus. This is hugely related to the gut, so much so that there's already been studies on this. When we start treating our gut with the right foods that build our good bacteria, we're seeing these conditions improve. Well, the problem becomes it's hard to get those right fibers considering all the toxins we have. So how do we get something to help us? And we're going to talk about the tools we use. And then the inflammation. The inflammation that results as a secondary ugly sister to insulin resistance causes a lot of pain, back pain, joint pain, arthritis, decreased mobility. Erectile dysfunction. This is the doorknob question I would say I always used to get from my male patients would be, by the way, doc, I deal with this. Well, yeah, when we have nitric oxide being impaired, those blood vessels are not going to dilate, and that's going to make something like erectile dysfunction very difficult. And then we also see that testosterone drops. And so this becomes a problem for our men. And so ladies, when we start actually helping them with the right lifestyle changes, we can get that part back too. So literally trying to save marriages with the lifestyle changes. So people are like, I go to the doctor all the time. They check my labs, but nobody says anything. You know what? I don't really feel good. What's missing? Well, just looking at A1C misses the full picture. Prediabetes isn't called prediabetes until your A1C is 5.7 to 6.4. But between 5.0 and 5.7, you're actually having an increase in your cardiovascular risk. And people are running around thinking everything's great. Well, insulin resistance can take 10 to 15 years before your sugars actually go up. So if we wait to the sugars, we have been waiting too long and we have too much damage in our body already. And now we're fighting a difficult battle when we could have started things sooner. Okay, so what things do you need to check? You need to ask your doctor for a fasting insulin level when they check your labs. And they're going to ask you to fast for your cholesterol anyway. So just ask, can we check insulin too? Your triglyceride HDL ratio, since they're looking at your lipid panel, you can really just get your results and look at that ratio. Even if triglyceride and HDL are in the normal ranges on that lab report, the ratio may not be. So look at that, because if that is more than 2, you are definitely dealing with insulin resistance. More than 3, oh my gosh, it's severe. Okay, we need to be looking a little bit closer. Looking at your waist circumference, because what you want to divide is you want to divide your height in inches by your waist in inches. Okay, if that's more than half, yeah, then you probably are dealing with insulin resistance. Inflammatory markers like CRP, ESR, those things are helpful because when insulin stuffs those fat cells, they make pro-inflammatory markers. And so that's going to give us some sort of insight what's happening. Okay, and then of course your symptoms. So final thoughts. So optimal health goes beyond just managing numbers. Okay, so we're not just waiting until the A1C is elevated. We want to deal with these symptoms that have you feeling not right. So we want to have more of a proactive approach. Okay, your body isn't broken. You just need the right tips and tools. And that's what we want to talk to you tonight, is about the tools that we've come across that are making a difference in so many people's lives. So I hope that was helpful. And I'm going to get out your way, Dr. Esther.
Okay. And I like to say, as I bring up my my slides here, so, we talked about that waiting for the A1C to be abnormal is waiting too long. I had never had an abnormal A1C, but when I checked my fasting insulin, so if I just waited, my A1C is normal. And when I say normal, it actually used to be about 5.1, 5.2, and that is with anemia. So if you actually calculated it for the anemia, it would be like 4.8, 4.9. And if that's what I was going by, I would say, I'm good. I don't need to worry about anything. But lo and behold, when I did my fasting insulin, 57.5. Well, we said the optimal level is 5 and below. So that tells you that you can actually be harboring a lot. And if you're waiting just for the markers that we are so used to looking at, you can actually miss a major window of taking care of the problem. And, 3 months into taking this protocol that I'm going to talk about, my fasting insulin was down to 2.5. So, a major change. Okay, so the protocol that we are talking about that helps as a tool to help you take care of all these things, the gut dysbiosis and the insulin resistance. Yes, lifestyle change is a big part of it, but we all know that lifestyle change is often difficult, most times not sustainable, and many times when you're too far gone, just instituting the eating well and, moving more does not really help. You need these extra tools to help you. And that's why the Feel Great system was created. So this is not a program or a diet. This is a sustainable lifestyle tool. So it's made of 2 food-based products, also called nutraceuticals. And we combine this with the science of time-based eating. And together they form this simple, sustainable protocol. Why time-based eating? Is that we know when we give our body a break from dealing with the onslaught of glucose, then a lot happens. There's a lot of cell repair. There's a lot of, the gut microbiome, the diversity of it actually increases because there's some parts of the microbiome that thrive without having to deal with food coming through the gut. So when you give the gut a break, you actually allow them to thrive. And at the same time, when you give the sugar control system a break from eating, you actually let that insulin go down. And when insulin is low, then usually fat has to go. And all those other things that result from having high insulin also start being reversed. So what is involved? The first product is called Unimate. This is an ultra-concentrated yerba mate. You've probably heard of the yerba mate tea, a plant that grows in South America. used for eons in various capacities there. What this company, Unicity, has done, they've taken the yerba mate leaves, they've fire roasted them, and then extracted the active ingredients of chlorogenic acid, theobromine, and the natural occurring caffeine in it. And then they've purified them and then ultra concentrated it, so that what you have as the active ingredient is super concentrated in Unimate as opposed to what you find in the natural plant. What does chlorogenic acid do? The benefits, it just supports a feeling of well-being. It increases your GLP-1 production by about 67 to 70%. And this helps with that feeling of satiety and helping you not have these food cravings. It helps you be able to fast longer because you're not feeling hungry. So it supports your weight management efforts. It also promotes lipolysis. So you can imagine taking this while you're fasting, when already your body is utilizing fat burning as its source of energy. And then you accentuate that with something that actually promotes lipolysis, which is fat burning. So you actually accelerate that process. It helps with increasing endurance and stamina for those who are working out. So it's actually a very good drink to take while you're working out. And it also supports mood. It has a lot of antioxidant and anti-inflammatory effects. And we take this while we are fasting. You can enjoy it anytime while you're fasting. You can take it all day. It's non-addictive. As I said, it helps with improving all these things and actually promotes healthy digestion. Sorry about that. The other product is Balance. We talked about the gut microbiome and why we need to nourish it. Now, Balance is a blend of 7 different fibers made in such a matrix that when you take this, you take it before your most carb-heavy meal. You take this about 5 to 10 minutes, you mix it with water, and you chug it down. As I said, the tea can be enjoyed at any time. The Balance is best taken just before a meal. What it does is that when you take it before a meal, now all the food that you eat after that is coated in this fiber matrix. And therefore, it's like you just added lots of vegetables, but this is a super blend of this fiber. And what it does is that first, because it's fiber, you stay fuller longer, and therefore it curbs your appetite between meals. You don't feel hungry. And then it actually reduces the glycemic index. When we talk about the glycemic index, that is how high and how fast your glucose rises. The University of Sydney actually studied this and says that it lowers the glycemic index by about 40%. So while someone next to you has taken a slice of cake that probably raises their blood glucose by 100, yours will only go up by 60 because it's been lowered by about 40%. It also helps reduce the amount of dietary cholesterol that is absorbed into the bloodstream. And then the other way it helps reduce cholesterol is because it takes a lot of bile acids to digest all this fiber. And therefore, you're going to pull a lot of cholesterol from your bloodstream to make the bile acids in the liver. It's been studied by the Cleveland Clinic, and they say that, and I'll quote, such a product, if taken regularly, could reduce cardiovascular risk on a population level and potentially decrease the need or the dose for lipid-lowering prescription drugs. And in this case, they're talking about statin medications, the lovastatin, simvastatin, pravastatin. It helps support healthy blood glucose because, as we said, it reduces how fast and how high your blood glucose goes. So it supports weight management like that. And because you're not going to have a spike in insulin since your glucose is not going up, so you're not going to store fat. And this is a very good tool to help manage that time-based eating, because if you're staying fuller longer, then you don't feel like eating every so often. We've also found that because it is a perfect blend of the 7 different fibers that is in the appropriate ratios to actually feed the diversity of your gut microbiome. It is a blend of soluble and insoluble fibers, and it helps feed all the various aspects of your gut microbiome. And therefore, you have a diverse and very thriving gut microbiome. So that's why you hear people having gut issues, IBS, constipation, diarrhea, Crohn's, colitis, all these things get to improve. And a thriving gut microbiome, 90% of your body's serotonin is produced in the gut. Serotonin and GABA, those are your feel-good hormones. So we have people who have come off their anxiety and depression medications simply because of this. So as I said, you take, it's a pre-meal drink. The ingredients, I know someone asked me about what the fibers are: gum, arabic, locust bean, citrus pectin, oat fiber, beta glucan, and a lot of vitamins also, the whole B complex, A, C, what is the other, chromium, really a lot of good stuff. So how do we take this? When we wake up, so when you eat dinner and you're done eating and maybe you took your balance before then you can drink water, you go to sleep. When you wake up in the morning, simply because of the nighttime, you've already been fasting. And so what we want to do is extend that fast by delaying your first meal of the day. And therefore you take your unimate, which is the tea, which curbs your hunger and allows you to extend that fast. Then when you eat lunch, you want, or the first meal of the day, which for most of us, that's lunch. So you want to make sure that that meal has a lot of protein, a lot of fiber, and a lot of good fat. Then you take another tea in the afternoon. And then for most people, and this you can do whichever way works for you. For most people, their largest meal is often dinner. For some people, it is lunch. You want to take your balance, that's a fiber, about 5 to 10 minutes before your largest meal of the day. At some point down the line, you can add a second balance if you have 2 wholesome meals. But I always advise people start with just 1 balance, because that's a lot of fiber that you're taking, that you're suddenly adding to your diet. So you don't want to have all the complications of too much fiber simply because of adding too much right at the beginning. And so you do this 2 products and, with amazing results. So what makes these products different? Right now, actually over 25 clinical studies, these products are HSA and FSA qualified. They're nutraceuticals, so no side effects. This is all food. It is plant-based. Right now, available in actually over 65 countries. They're patented, and then the company actually gives a guarantee. 90-day money-back guarantee if it does not give you any improvement with consistent use. These 2 are the only nutraceuticals that are in the physician desk or digital reference. And as you can see from this chart here, you take the Unimate when fasting, the balance while you're eating, and it keeps you in this fat burning. It keeps your glucose and your insulin levels in the fat burning zone, as opposed to here where you get to the fat storing and damage zone. Very high quality products, third-party certifications, clinical studies with leading hospitals. I just mentioned a couple of them, patented, and the ingredients are sourced directly from farmers. And these products are helping lots of people with life-changing results. This is just a collage of many of them. I'll show you one by one. That is me. This picture was actually, this was 4.5 months apart, just shy of 5 months. Same dress. The one on the red carpet had a lot of Spanx underneath that dress just to hold everything together. Dr. Tiffany always reminds me, I look beautiful in both. I felt much better in the second one, the one that I took later. Now that dress does not fit me anymore. If I try to put it on, it looks like I borrowed it from somebody.
Yes.
This is Richard in the middle. Richard had a lot of gout on the highest dose of allopurinol for years. Richard now is no longer on allopurinol. He was also on the highest dose of Ozempic for months. He no longer takes Ozempic. And he moved from a size 4XL. At this point, he was at 1XL, and I think now he's gone down, even much lower. This is Dr. Dita. Dr. Dita is one of the colleagues who's sharing in this mission. In black, Dr. Dita had discovered intermittent fasting, and he was running about 3 days a week. And that is what he came to. 2.5 months on the protocol, and that's him in the salmon jacket. My friend Josephine, who connected me to Dr. Tiffany, that was her. Before and after, a lot of that visceral fat in the mid area all disappeared. Carolyn Bird, she's a cancer survivor and was also able to, lose a lot of weight. And now she's much healthier than she was before and is part of us spreading this mission. What I want you to look at, look at the faces. You don't realize how much when you have all this chronic inflammation and when you're storing stuff you shouldn't be storing, how it even changes your face. We've had people who say that once they've been on the protocol, now their facial recognition doesn't recognize them anymore. And as you can see, people look different, I like to show this picture because of Cody here. Cody lost 52 pounds on the protocol because it changed his life. But why I like this picture is because people say, how, if you lose all this weight, aren't you going to need, to get like some tucking and nipping here and there? No, you don't, because you lose fat, you do not lose muscle. And so there's no sagging skin or anything like that. Raw here, A1C went from above 14, most of these devices do not read anything. Once it's above 14, you're on your own. But it went from an unknown number above 14 to 5.9. Looks like a new person. That's Dr. Dita again. And this is Dr. Dita's twin sister. Once he discovered this, he also let her know about it. And that's her. This is Jim Gracer. Jim, A1C of 12.3, down to 5.2. And as you can see again, a lot of weight loss. And I remember Jim being on a live with him and him saying even his mood and coming from a place where you have to struggle with depression over years and getting to a place where that is no longer something that is part of your life. I mean, 155 pounds down, that's like shedding off another whole human being. Reversed his type 2 diabetes, cholesterol, blood pressure, triglycerides, no more medication.
Yeah.
This, I could go on and on. Sleep apnea, high blood pressure, the changes. This is another of our colleagues, Dr. Natasha. For her, she dealt with a lot of gut issues, fixed those, and, her metabolic reset happened. This is Keith. I'll show Keith here. He has a long story because Keith's life has really been changed. That is Keith. That is Keith's foot. January 2025, diabetic ulcer. This ulcer also almost took him out when he had sepsis and ended up, having to be resuscitated on a table in the hospital. This was after $180,000 worth of treatment, hyperbaric chamber, and all that. 3.5 months on the protocol. If I didn't know Keith personally, I would think these are fabricated pictures, but yeah, this is what happened. And this is something that knowing how much people spend and just the burden of having to deal with chronic wounds, and to see that you have something that could give people a chance to come off that. Yep, and I don't need to go on with all this. You get the
Yeah, we can talk about this forever. It's just wonderful what we're able to do and how we're able to help people. I enjoy what we're able to do. Thanks so much for explaining the whole protocol, Dr. Esther. You know what? There was a question in there in the comments. And if you do have some more questions, definitely put that down in the comments in the chat. But Catherine, hi, Catherine. Catherine has a great story herself. One day we're going to get her to talk about her story too. But she was asking, what would cause someone who's been using the products for 6 months to start developing neuropathy in the last 2 weeks? I have an idea what I think might be happening, but what would you say, Dr. Esther?
I think my first question is, Catherine, did you have neuropathy before? Because we know that this products actually do help with neuropathy that happens because of insulin resistance. So if you've been on them for 6 months and this is something new, I would look at more of an anatomical thing, something else going on to cause your neuropathy rather than insulin resistance being the cause. And maybe that's what I would investigate. But of course, I would need more history to know where exactly is that neuropathy, what is the character of it, and all that stuff. But I would look not at something that is metabolic, but actually look at something that is being caused by, something more physical.
Yeah, she said somebody on her live asked her that question. The reality is we just need more information. We need information like, what are we talking about? Because we use neuropathy. Now, we know what we're talking about when we say neuropathy, but sometimes I find that patients may be saying something else. What is the sensation? Where is it? The hands, the feet, the arms, the legs? Is it both sides? There's so many other questions. That's why the great thing about using these tools is that you do get connected with a person to be able to ask these questions. You don't just buy them over the counter and then just kind of do things on your own. You get connected with the people you order the products from to ask questions to find out, okay, do I need to go see my doctor? That's depending on what's happening, that might be the bottom line question. The bottom line answer. Yes, Catherine. That's what Catherine said. Told her to go back to her doctor. Yes. Too many questions. But yes, when you love to help people, you get yourself caught in answering a lot of things when at the end of the day, it might just go to a professional. Alrighty. Oh, Diana has a question over there. I'm having trouble getting enough protein. Since doing this, I used to fast for 12 hours. I have my Unimate and 30 grams of protein. When I don't have breakfast, I don't get enough protein with just 2 meals. Okay. You want to take it? Want me to take it?
Yeah, take it.
Well, okay. So the whole fasting schedule. Let's use this to open the door with the fasting schedule. So I like to meet people where they are. So some people may not need to miss a meal depending on what their goals are. They may just need to not snack between their 3 meals and get their 12 hours of fasting because that would give us at least 12 hours. Now, I use other things to help get my protein in if I am trying to extend and miss a meal. I use some protein shakes. And what's great is we have a new protein shake out too to be able to use that only has 4 ingredients in it. You can't get any cleaner than that. So I use that. I use eggs. There are so many things. Yeah, Linda Kay just talked about the new protein supplement. So sometimes I add some other things. Sometimes I'll do a protein shake after my meal to give me some more protein in. So yes, you have to be creative. You do. There's ways. But at the end of the day, it goes back to, do you need to fast and skip a meal? If you do not, then have your 3rd meal and have your protein then. That would be what I would probably say.
And one of the things we know that if you take, protein that is clean protein, not the protein that has so much sugar and so much other added stuff that it's just messing up with your gut and, with your blood glucose. If you take clean protein, it doesn't spike up your blood glucose like, if you were to take carbohydrates. So you could get away with having a purely protein breakfast. It won't spike up your blood glucose and then leave if you're going to have carbs or anything else at other times when you're going to take the balance. But yeah, if you feel that you need to get that protein in, it's okay. You can add just a purely protein-fed meal if you need to. Or as, Dr. Tiffany said, sometimes I would do, I haven't got the new protein yet, so I would use Stronghold. But sometimes I would mix the Stronghold with my, with my balance and actually drink it at the same time. So right there, I was getting a lot of protein. So that meal, whatever was on the plate was already, I already added the protein in the Stronghold. Yeah.
Yep. I just got my protein, so I'm gonna be trying it this week. So yeah, that sounds good. Well, thank you for your questions, Diana and Catherine. Thank you guys so much. If we have any more questions, here's time to drop that in here. Can this help sarcoidosis? Jay's asking. We talked about the gut. And we talked about the immune system. So with insulin resistance, the immune system actually takes a hit. And that's where those autoimmune conditions come from. So when you start actually feeding the gut, your gut microbiome, the trillions of bacteria in there, we see those immune conditions actually improving. So we have people like Jenny gave her testimony with rheumatoid arthritis, not having that arthritis pain. We have people with ulcerative colitis, not having those same types of symptoms in their gut. So the reality is the treatment for these autoimmune conditions are immunosuppressants, and that's just killing your immune system. So why not try a product that's going to try to give you the bacteria back to heal your gut, to help? But we are seeing people actually get some improvement. Mhm. We are. And there's inflammation with that too for a lot of people with sarcoidosis. So definitely when you lower the insulin levels, inflammation goes down. Okay. So Paula Goins says having some problems with constipation with the balance. We get this question all the time, don't we?
Yes, we do. So, Paula, one of the things they say is, and I now advise people just like right from the beginning. For one, you need to increase your water intake.
That's big.
You're taking a lot of fiber. You are sometimes people think that just by taking the Unimate, that's enough water. No, you need a lot more water. We always say divide your weight in pounds by 2 and drink that amount of water in ounces every day. That is at least what is recommended. Now, the other thing is that you can cut back on the balance, let's say to half a pack. I have even told people sometimes to just start with 1 teaspoon and get yourself regular and then keep increasing gradually back again all the way to the full pack. Some people, there's that adjustment period where some people have constipation and bloating. And then there's some people who actually have loose stools. When they go to the bathroom, the stools are loose. And either of those is because your gut is just trying to adjust to this new thing that is coming in. It is going to help it. But sometimes you may need to just introduce it slowly to the point where your gut gets used to it.
Mm-hmm. Mm-hmm. Yeah, very true. I mean, if you think of it, you have trillions of bacteria there, and now you're dumping all this fiber in there, and your gut is like, what am I supposed to do with this? If you're having gut that's struggling, yeah, there's going to be an adjustment period. But if you're consistent, just like Dr. Esther is saying, we see people 3 months, 6 months who are like, oh my God, this is the best. I'm having the best stools ever. But you do have to be consistent though. And we have one more question. How does the Feel Great program help heal IBS directly? So I never use the word heal. I don't use that word only because, you know what? Let me not say it that way. I'm not saying that these products heal anything, but we have the science that shows us over and over and over again. If you treat your bacteria with the right foods to increase the good bacteria, the gut starts to heal itself. So there doesn't have to be something magical in these products. What they're doing is they're giving us the things we're missing. They're giving us the things we're missing without the toxins. They're giving us the things we're missing without the ultra processed foods. And they're boosting the growth of the good bacteria. And so what we're seeing IBS actually heal with doing that type of thing. The leaky gut problem that leads to the bloating and abdominal pain, that's coming from the inflammation from the insulin being too high. It causes a breakdown on the lining of the gut. And so that's when those symptoms come from. And once we get the insulin down, the inflammation improves. Now we have people having better guts. We're having people having better symptoms in the IBS. We're seeing that improve. Okay, Betsy, good, good. Glad you had those words. Awesome. So, Dr. Esther, lasting words, lasting words.
Well, thank you so much for coming to our Sister Docs call. And if you're wondering, okay, so how do I get this product? Whoever invited you to this call or wherever you found this, whoever posted it there, please reach out to them and they will share their direct link so that you can get this product at a discount and get the support. By using the referral links, you actually do get linked to someone who's going to support you as you take this. As you can see, people have questions when they start using them and they need that support. So you will get that support by using those links. And you also get connected to this community of many other people who are using the product. So you will get that support too from fellow users and, you know, kind of brainstorming and seeing, you know, what's what as you go ahead and use it. But thank you so much. If you think someone else needs to hear this information, we'll be back here next Wednesday. So please join us, same time, same link.
Look, oh, before, not to cut you off too. We're gonna be in. I am going to Josephine. So I'll be in Maryland on Monday, which is great, and we're gonna be in Norfolk, Virginia too. So if you have anybody in those areas, please reach out to the person that got you on this call because they can get you flyers for that on where we'll be in Norfolk, and Josephine putting here the flyer for where we'll be in Maryland. And we'd love to meet you in person, shake your hand, and we'll be talking about these products in person. So not just over Zoom. So I know Dr. Esther was on a roll. I'm so sorry, but I want to make sure we highlighted that because, you know, I know Josephine's so excited about this whole event she's getting together. And so I want to make sure we brought that up. Yes. Well, thank you so much, Dr. Esther. You have been awesome. Awesome. Oh, Josephine didn't know I was coming. Yeah, I'm coming. I'm so happy we get to do this together. I appreciate you, my sister doc. And just like you were saying, anybody who invited you here, we're doing this again in a week. So invite some people to come out in a week. We're going to end the whole science portion of this and what we're talking about in regards to the products. And so if there are interviews that say, okay, look, these two doctors and these people that are on here, Josephine and Jenny, and they've decided, I like the mission. I want to see what that's like. We're going to do a short call about what it looks like to join the mission and to help us with trying to reach more people. I'm on a mission to help 1 million people because I'm tired of seeing people die. Let me just be that clear. I literally am. I'm tired of seeing people on a bunch of meds. And so I want to be able to help so many more people than I can do by myself. And this mission is big enough. So if that's something you want to hear about, give us about 5 minutes. We're going to stop the recording on this and get moving, but we're going to stay on the same link and talk about how this looks as the mission.
Okay. Hi, thank you so much for coming on.
You know what we need? We need some music.